Good afternoon, everyone. Good to see you. Thank you very much for joining us. Firstly, is now the custom, just to update you on the number of cases overnight. We've had another reported, the Department of Health has reported another 35 cases of COVID-19, which brings the Western Australian total to 175. We've had 5 of these new cases are in regional Western Australia, 2 are in the Kimberley, 1 in the Midwest, 1 in the Wheatbelt and 1 in the Great Southern. So the department is still working through the contact tracing details of the new cases, but this is what we know. 35 of the new cases overnight are 18 are males and 17 are females. The ages of the new cases are from 4 to 76. So we've had 2 young children, one aged 4, the other 10, both from the same family and who contracted the virus from a known contact. Of these new cases, 8 are passengers of the Ruby Princess and 4 are from the Ovation of the Seas, the cruise ships that were docked in Sydney Harbour. So now you see just what an impact those 2 cruise ships have had nationally. The travel history of the further 7 cases has been confirmed, and they include the UK, the United Arab Emirates, the Netherlands, New Zealand and Mauritius. So the department is in the process of interviewing the remaining new cases to determine their travel history and also to identify their close contacts. There are currently 11 COVID patients in Perth hospitals, 4 in ICU. So to date, we have tested 10,335 patients with negative results, and 1,341 of these negative tests have come from regional Western Australia. As I foreshadowed, we've been asking the CDNA, the Communicable Diseases Network Australia, to advise us in relation to alterations we can make to the testing regime. The testing regime that we will now be pursuing essentially has 3 aims. One is that we want to protect the vulnerable. 2, we want to pick up individual cases and to be able to scan the horizon to see them easily. And 3, we want to increase our awareness of any community transmission as that starts to take place. So we're not actually changing the testing regime at the COVID clinics at this point. That will remain for those people who have travelled from overseas in the last 14 days, asymptomatic and have had close contacts with the known COVID patients. We're also, of course, at the COVID clinics testing those healthcare workers who have a raised temperature above 38 degrees and are experiencing influenza-like illness. Now we will be moving to an aggressive outreach program in relation to the public health networks of the Department of Health. We will now be targeting geographically localised areas where we have become aware that there's community transmission. Other settings where there's been an outbreak. Sorry about that. We'll also be testing people in other settings where we identified localised outbreaks. So you can understand if we've got a localised outbreak in a particular community, that will then lead to a heightened awareness around the public health units in that community, and they'll start testing a wider group. In addition to that, any cruise ship passengers who have disembarked in the last 14 days. So not just those people who are returning from a cruise ship that's been in international waters, but all cruise ship passengers. Where there has been no community transmission occurring, however, there have been examples of respiratory illness in locations of vulnerable communities. We will test for all respiratory illnesses. That includes aged and residential care settings, remote Aboriginal and Torres Strait Islander communities, detention centres or prisons, boarding schools, military barracks or equivalent. So that is, if we see respiratory illness of 2 or more cases in any of those settings, we'll then undertake COVID testing of all respiratory illness in those particular settings, and other settings as the situation reveals. We will continue to test hospitalised patients where there's an illness of an unknown cause, such as having a fever and respiratory illness, and that'll obviously be both in the case of inpatients and patients in our emergency departments. Today I'm joined by the Group Chief Executive Officer of the St John of God Healthcare, Dr. Shane Kelly. I want to restate the importance of our private health system in terms of making sure that we have the facilities and the capacity to address the COVID-19 outbreak. In a moment, Shane will be making some comments with regards to St John of God Healthcare. But I just want to re-emphasise the collaboration we're receiving from our private hospital networks at the moment is outstanding. They've got a great relationship with our teams in the Department of Health, and as a result of that, Dr. Kelly would now like to make some comments.
Thank you, Minister. As the Minister's indicated, we stand ready to help with this crisis. We have important facilities, including intensive care units, where the capacity will be tested for the system. So we're ensuring that we've got as much capacity available as we can to deal with this problem as it continues. We've also decided to reduce our elective surgery and essentially only now operate on urgent cases, and that's for a number of reasons. One is capacity, including intensive care units, but also in relation to safety for staff and surgeons and our patients, and the limited supply of personal protective equipment. Happy to answer any questions.